Now, in this fourth section, we will talk about some infections that are acquired during the delivery. These infections which can affect the baby during the delivery or that are acquired during the delivery include herpes infection, then we have group B streptococcus infection, chlamydia and gonorrhea. So the herpes infection, usually the herpes simplex virus, but the genital herpes is caused by herpes simplex virus 2. So herpes simplex virus 1 is more common herpes infection, but the genital herpes is caused by herpes simplex virus 2. During pregnancy increases autism risk. So during the pregnancy, during the delivery, if it affects the baby, it can cause autism, increases the chance of developing autism. Herpes simplex virus 2 infection during pregnancy triggers maternal immune response. This response disrupts fetal central nervous system development, raising the risk for autism. So during the delivery, it increased the maternal immune response, and this maternal immune response can affect the growth of the central nervous system, and there are chances of developing autism in the newborn baby. Neonatal herpes, localized to skin, eye, and mouth. Death in treated babies is rare, and neurological morbidity is less than 2%. Local central nervous system disease, its death is about 6%. Neurological morbidity is 70%. Disseminated infection is 30% is death and 17% is neurological morbidity. So if we see this chart here, we can tell that if there is local central nervous system disease, if central nervous system is affected locally, more than neurological complications can occur in 70% of the cases. But if it's disseminated infection or it spreads widely, then the death is more, and it affects 30% of the newborn babies. Mother with active herpes infection here, and then blisters due to congenital herpes. The congenital herpes, the baby usually have the blisters showing like this in congenital herpes. Factors influencing the transmission. Types of maternal infection, presence of transplacental maternal neutralizing antibodies, duration of rupture of membranes, use of fetal scalp electrodes, and mode of delivery. All these are the different factors that can affect the transmission of herpes infection to the newborn baby. Management is initial infection. Usually we treat 400 milligrams orally 3 times a day for 7 to 10 days, and then acyclovir, and then valacyclovir we give 1 gram per oral for 7 to 10 days. If it's symptomatic recurrent episodes of infection are present, then 400 milligram again 3 times a day for 5 days or 800 for 5 days. Then we can, valacyclovir is 500 milligram for 2 times a day for 3 days, or 1 gram orally daily for 5 days. If for daily suppression of, we use the acyclovir 400 milligrams from 36 weeks estimation gestational age until delivery. And then valacyclovir again is 500 milligram 2 times a day from 36 weeks onwards. And if it's cases of disseminated infection, only we use acyclovir, no valacyclovir, 5 to 10 milligram per kilogram intravenously for 2 to 7 days. So all these are different indications and dosages, how much is used under different conditions of the infection. Next is group B streptococcus. Streptococcus agalactiae cause group B streptococcus infection. If there is failure to treat abnormal group B streptococcus, screening with antibiotics. Then if there is failure to treat abnormal urinary tract infection, culture with antibiotics. So this is if there is failure to treat abnormal group B, and in case of urinary tract infection, we do culture with antibiotics, and in this case we do screening with antibiotics. Infection result in damage to baby brain, and infection result in premature labor and delivery. So if there is infection by group B streptococcus, which is mainly caused by Streptococcus agalactiae, and it can cause damage to the baby's brain and also cause premature labor and delivery. The management of group B is vaginal and rectal group B streptococcus screening at 35 to 37 weeks gestation for all pregnant women should be done. Intrapartum prophylaxis indicated if there is previous infant with invasive group B. So if there is a history of previous group B streptococcal infection, we should treat them prophylactically. If there is group B streptococcus bacteriuria during current pregnancy, if there is positive group B streptococcus screening culture during current pregnancy, unknown group B streptococcus status, and if there is a delivery less than 37-week gestation, amniotic rupture of membrane more than 18 hours, and if there is fever more than 100. All these are indications for intrapartum treatment, prophylactic treatment for group B streptococcus. If not, these things are not present, if these conditions are not present, if the membrane is not ruptured more than 18 hours, if there is no fever, if there is no culture of group B streptococcus in this pregnancy, and if there is no previous history, then we don't need to treat this patient prophylactically during the delivery. So all these are the management steps for group B streptococcus. Next is the chlamydia infection. Chlamydia trachomatis is the causative agent for chlamydia infection. Frequently it's asymptomatic, no symptoms are present. Infection associated with preterm rupture of membrane and preterm delivery and low birth weight. Transmission to fetus cause conjunctivitis and pneumonia. So chlamydia caused by chlamydia trachomatis, you can see the infections here, and it can cause premature rupture of membrane, preterm delivery and low birth weight infants, and transmission to fetus cause conjunctivitis and pneumonia. Next is gonorrhea. Neisseria gonorrhoeae is the causative agent, cause low-grade fever, rash, and polyarthritis. Multiple joints are affected. You can see the rash present. And then there is increased risk of co-infection with chlamydia and preterm birth. So chlamydia and Neisseria gonorrhoeae or gonorrhea can coexist together, and it can cause preterm birth. Transmission to fetus cause ophthalmia neonatal. Treatment is with cephalosporins. So that was all about the infections that are acquired during the delivery. Thank you for watching sqadia.com.